People will continue to come in. So thank you all for joining us for Healthcare for All Washington's second Wednesday speaker series. I'm Ronnie Shure. I volunteer as president of the board of directors for Healthcare for All Washington. Tonight, we'll take a deep dive into our long-term care services and support for workers in Washington State. Ruth Eggers from the board of Washington Cares Fund will share some personal insights. And Erin Lee from the No on I-2124, the initiative that's trying or intended to destroy the Washington Cares Fund. They will be leading our discussion tonight. So thank you for joining us. So I'm participating in this Zoom meeting from the lands of the Coast Salish people. Our effort to achieve healthcare for all includes all the peoples of this land. Please take a minute to acknowledge the peoples in the lands where you are joining us from today. We acknowledge all of the ancestral homelands and traditional territories of indigenous peoples who have been here since time immemorial. Our efforts to achieve healthcare for all include universal healthcare coverage for the Coast Salish peoples of this land, the land which touches the shared waters of all tribes and bands within the Duwamish, Muckleshoot, Puyallup, Suquamish, and Tulalip Notions. So first, let me go ahead and introduce Ruth Egger, the first speaker. Ruth is a representative, the consumer representative on the Long-Term Services and Supports Trust Commission that runs or supervises in the implementation of the Washington Cares Fund. She was a gerontologist, an innovative leader in providing senior services and training caregivers, and she's going to share a story of becoming a caregiver herself. She's been a community advocate who has helped the state develop that Washington Cares Fund to become the first in the country to do that. And she's also worked in social justice for seniors, for immigrants, and for all Washingtonians. So Ruth, why don't you unmute yourself and let's get started. Thank you for joining.
Okay, thank you. Thank you, all of you. I can't see who's here, but thank you for inviting me to speak to you today about WA Cares. As Ronnie said, I'm a member of the WA Cares Commission and a retired professional in the gerontology field. And I wanted to tell you how I got involved in this work and how it will help people as they age or if they become disabled as a younger person. First of all, so as Ronnie said, I was a caregiver as well. My parents have passed. The last one, my mother died 2 years ago, but for about 6 years, I was a caregiver for both of them. They had moved to Seattle from New York, and I was caring for them from a distance. They lived in Issaquah. Thank goodness I didn't need to do that much for them, but I did have the emotional impact of being a caregiver. And thankfully also they had private long-term care insurance, which was really able to help them a lot with getting additional services in their home. I began working with the WA Cares team to pass the legislation in 2018. I was part of PASARA, and they were involved in the development of the bill since 2014. I had just retired from working for 40 years in the gerontology field. And my last position was with Homage in Snohomish County as a family caregiver specialist. My position was to work with unpaid family caregivers who cared for a loved one, a spouse, parent, child, friend, etc. So I was working in that position as I was also a caregiver for my parents, which caused some conflict for myself. I saw firsthand how difficult it was to provide care as well as to care for yourself. If any of you are caregivers out there, You really can't be a good caregiver unless you're taking good care of yourself, because you burn out and you become resentful. So that might mean taking care of yourself might mean having some respite care for the caregiver, to go to a doctor for their own health, or having lunch with a friend. Many caregivers, especially people who were in the working world or younger, have to leave their jobs to provide care for their parents or their spouse. And some caregivers or some care recipients have no family nearby, and they don't have anybody to ask for help. So WA Care Fund will be able to pay a family or a friend to care for a loved one, or it could provide resources to remodel a bathroom so it's accessible. The real reason I got involved in this work is that one of my clients, a wife, was caring for her husband who had ALS. And in order for her to have a few hours off during the week, they needed to hire a nurse, an RN or an LPN, to provide care, because her husband had a breathing tube and it needed suctioning, and they couldn't just hire an untrained aide. They needed someone with a medical experience. They didn't have the money to be able to do that. And so they did a GoFundMe to raise funds for respite care. And that's really what motivated me to work for the passage of WA Cares. It just felt so unfair. This person who had been a teacher, the husband, had been a teacher on the military bases in different countries around the world. He didn't get any veterans benefits, and he had given his life to the military and the military's kids, and he still didn't have any money to be able to care for himself or give his wife some respite time for her own self. So a little bit about WA Cares is that many people who need assistance will benefit greatly from WA Cares. Some of them live alone and have no support community nearby. And if they are eligible for Medicaid, they will be able to receive a state caregiver. But a person who is a little higher income and has more than $2,000 in their savings, that's what the level is for Medicaid. You only can have $2,000, and that hasn't changed since the 80s. They would have to pay for a caregiver to give them assistance. An example might be a person who needs bathing assistance if they have balance problems, or a person who has a brain injury trauma and needs a ramp built, or someone who has mild dementia and needs some cueing to take their meds or prepare their meals. So this is what WA Cares will do. It will pay, if once you've paid in for 10 years, or there is an exception of 3 years out of the last 6 years, if you paid in and you need assistance right away, like if you've had an accident or a brain injury or a stroke and you need help right away. But mostly this is going to be for people like myself, people who are aging, and they might need assistance, but not to live in a nursing home or an assisted living or an adult family home. They just need a little bit of assistance to stay in their homes, and they really don't have the extra resources to be able to pay for a caregiver. A caregiver can run from, I don't know, I think now it could be almost $30 to $40 an hour from an agency. Since we passed the WA Cares, a few improvements have been made. Anybody who is in their late 50s, early 60s, and are still working, and if they retire before they pay in for 10 years, they'll be able to get a percentage of their benefits. People who move out of the state can also qualify for WA Cares. And some classes of people are also exempt from paying into the fund, like veterans and veterans' wives, and some people who are non-immigrants, non-citizens. So WA Cares, in my opinion, is a great way to provide residents of Washington the security they're going to need as they age, if they need assistance in order to stay in their home and age in place. 70% of Washington residents will need long-term care. It will cover most of the need for some people, while others it will provide breathing room during one of life's most challenging stages, giving the family time to plan. So as we age, we hope to have quality of life in our later years, and WA Cares is one way to add quality to your lives. I just want to also point out that WA Cares will also serve people who are younger. And if, this is for if someone is in their 50s or 40s, excuse me, and gets early stage Alzheimer's, or they get Parkinson's at an early age, or they have a car accident and they have a trauma to their brain. WA Cares is a way for them to be able to get some assistance to provide care for them to hire care, actually, after their accident or incident that they have. Yeah, I think that's about all I want to say about it. So I'll pass it on to Ronnie.
So thank you, Ruth, for sharing that, and you almost underestimate or underscore the value or that you as a caregiver, a family member, can provide to someone who needs some care in order to stay in their home. It's so hard. You mentioned that, but I just wanted to underline how powerful that opportunity is and how meaningful it is to the people that can avoid going into long-term care,
Right.
going into a nursing home, or or even a rehab center for a long period of time. And you talked about $30 an hour for someone to help you stay in your own home, which is so valuable. But also, look at we need to also acknowledge the cost of going into assisted living. It's phenomenal.
Right.
$30 an hour is nothing compared to what we end up paying. And certainly going on to Medicaid, as you mentioned, is one option, but that can't happen with everyone. We don't all qualify for that, and it can demolish a family. So thank you for your work in helping to establish this, your work during your career as a gerontologist, and your current work on the board, this commission. So thank you, thank you, thank you. If you have questions for Ruth, please enter them in the chat. We will be doing Q&A after Erin's presentation, after the next presentation, and we'll pull Ruth and Erin together at the end of that to start a conversation to answer your questions. And I know some of the names I see on this list are people that have had that same kind of experience being caregivers. So please feel free to enter your comments or begin that process, and we'll bring you back in at that point. So I'm going to remove the spotlight from you, Ruth, but you're not leaving us. You're coming back. Thank you, thank you, thank you. And would like to add the spotlight to Erin. Thank you. Erin is a campaign organizer. She works full-time with SEIU, or a Service Employees International Union 775, but she's on loan to help support the defense of this initiative that has been created to limit the options, the funding for the Washington Cares Fund. Erin has been a social justice advocate for seniors in several different areas, and for everything under the sun. And by that, I mean that you have also worked on climate resilience. So she has been a very important part of our community, and would like to invite her in to share about the we're just learning about in the last few days. So thank you for being here, Erin.
Thanks, Ronnie. Let me just share my screen. All right. So once again, I'm Erin. Thank you for having me. I'm really excited to speak with you all about this really important topic. I'm here to talk about the threat that I-2124 poses to WA Cares. So just to jump right into it, Initiative 2124 is a deceptive attempt by a hedge fund millionaire to take away essential care benefits from people who are seriously injured, ill, or disabled. And Ruth did a great job of talking about what exactly is at stake and what we stand to lose if the WA Cares program goes away. So how are we going to defeat this initiative? Well, the keys are getting our message out early. We'll also be touting our endorsers and trusted messengers like doctors and caregivers. And we'll also be collaborating with Defend Washington, which is the coalition to oppose all 3 ballot measures. So that includes No on 2124. I say that number way too much every day. No on 2124, as well as No on 2109, which would repeal Washington's existing capital gains tax. This is a tax on stock market profits greater than $250,000. This tax generates nearly $900 million in yearly funding for early learning, childcare, K-12, school construction, et cetera. And it raises those funds from those with the most capacity to pay. This initiative is calling for effectively a tax break for Washington's millionaires and billionaires. So we have to vote no on that. And then also in the Defend Washington coalition is the No on I-2117 campaign. The Climate Commitment Act, or CCA, it makes big polluters pay for the harm that they cause to our communities. That money is then invested in things like increasing our resilience to wildfires, reducing flood risk, improving our public transit systems, and more. I-2117 would eliminate the CCA and ban Washington from ever creating something similar. So people from those campaigns can speak about it in more detail. I'm here to talk about 2124. So how do we, as supporters of the No campaign, talk about I-2124 and what are our top line messages? First, 2124 would cause a quote unquote death spiral for WA Cares, and that's according to actuarial experts. It would bankrupt the program by making it voluntary, taking away $8 billion in funding for long-term care. The initiative is framed as just creating the ability to opt out of the program, but that's very misleading. This is effectively an initiative to repeal WA Cares. A second top line message for us is that 2124 takes away care funds from 3.5 million hardworking Washingtonians when we need help the most due to serious illnesses, disabilities, or the impacts of aging. 2124 also harms people with pre-existing conditions like cancer and diabetes who are routinely denied private long-term care insurance. Over 50% of us have a pre-existing condition, so this affects a lot of us. And the last message we want to lead with is that 2124 leaves us at the mercy of private insurance companies, which jack up premiums by 50, 100, even 300% without warning. And they also charge women more. Only 3% of people have private long-term care insurance. And that's because most of us just can't afford it. So our campaign has a lot of momentum right now. Polling looks optimistic, and we've had some great media coverage. The most recent polling, which was commissioned by Defend Washington, shows support for all 3 initiatives is trailing badly by an average of 19 points. Media coverage has been helping to shift the narrative about the program and showing the true damaging effects of 2124. And then, as Ronnie mentioned, there was an exciting piece of news recently. There was a recent court decision about a lawsuit that was filed in an attempt to, by the initiative folks to keep public investment impact disclosures for the 3 initiatives from appearing on the ballot. There was a law passed in 2022 that requires disclosures if a ballot measure repeals, levies, or modifies a tax, and if it would cause a net change in state revenue. So this is a victory for us because when voters know what a catastrophic hole this would create in the budget, they understand why we have to reject these initiatives, because we simply can't afford as a state to let them pass. When it comes down to it, our campaign 2124 is the smallest in the Defend Washington bunch with the fewest resources. So we will rely on our partner organizations like yours to power this fight, and to help voters see through this deceptive initiative, and to help people understand that by rejecting 2124, we can protect 3.5 million working Washingtonians who are relying on this essential safety net. And we know that when everyone can access the help we need during the most physically and financially stressful times in our lives, we're all better off. So what can you do? Well, we ask that you follow us on social media, as well as like, share, and comment on our posts. This helps expand our reach and make sure our posts get put in front of more people. Or you can make posts yourselves about why you're fighting 2124. Social media is increasingly a way that people get their news, so we really have to have a big presence there. I especially want to highlight that on our LinkedIn page, our campaign is doing a series of interviews with people who are firsthand impacted by the threat of 2124. So there's some really powerful stories there. Secondly, we're always looking to build our bench of spokespeople. Right now, we're particularly looking for voices from the small business community, as well as folks who are in the sandwich generation. So these are largely middle-aged people who are providing financial support and or caring for both their children and their aging parents. So if you can connect us with someone who fits that description, or if you yourself fall into those categories, we would love to have you join our spokesperson team. We'll train you up and make sure you feel ready to talk about the campaign. You also don't necessarily need to fit into those categories. If you're just a passionate spokesperson, we would love to have you as well. The last thing is that we're always looking to grow our endorsers list. So to date, 250 plus organizations and healthcare professionals have endorsed the campaign. This is just a small sample. If you are a member of another organization that you think could or should endorse the campaign, we'd love to have them join us. So please just reach out to me and make that connection. So once again, I ask that you support us on social media, become a spokesperson, or connect us to folks you think would be a good fit, and connect us to other organizations that you're a part of so we can grow our endorsers list. We'll follow up with y'all later in the campaign if there are other ways that we need your support. And right now I'm going to put some links in the chat to our social media, our website, as well as my own contact information. But yeah, that's all I've got.
Thank you, Erin. And so look in the chat for her messages, as well as entering your questions, question answering there. You also can find the link to our website, and we would love to have you go in, and if you're able to make a donation, we do negotiate and support bills on our own for universal health care. We are striving to get coverage for everyone, and that takes outreach. It takes working for health equity issues and and support for services in a lot of different areas of our state. So please, if you're able, go into the chat and go to our website, make a donation if you're able. Certainly a one-time donation is very helpful. You can add your name to our mailing list, and we can keep you updated on activities that we're supporting, like the defending against these initiatives that will have a major, or would have a major impact on our state. These are victories that we have worked for years to build. So thank you for taking some time to go into our website, looking at that, and joining in that struggle to provide healthcare for everyone. You also can go to our website to get involved. So once you hit that donate button, if you are, you can find our website that will tell you where you can get involved and different roles that you could play in our organization. So thanks for doing that. We are putting questions in the Q&A or in the chat section. And so let's go ahead and bring both Ruth and back, and we will start with the first questions. And I think, well, let's bring you back first before I start talking about you, right? There's Ruth. Thank you. So the first question I see in the chat is about what is going on with Washington Cares. The question is that do art services being provided now, and I think the other is opening up for what the commission or the trust fund commission is doing as far as improvements or monitoring and implementing the program. Ruth?
Okay, so the first question asks what are activities that WA Cares will provide, I guess. I'm looking at the chat. So a person will have to have 3 ADLs. An ADL is an activity of daily living. So that could be needing assistance with bathing, walking, making meals, helping them get dressed. But in addition to those 3 ADLs, a person will also be able to pay a grandchild to drive them to the doctor, and the grandchild could get paid, or a friend or whoever will be the person who takes them to the doctor. It also provides, what's the word for it? Like accessible tools that you can have in your house to make your living situation easier for you. So that might be a ramp. It might be bars, security bars in your, or grab bars in your bathtub. It might be taking out a bathtub and putting in a walk-in shower. Those are some things that WA Cares can provide. So it's transportation, equipment, and caring for you, physical care for you. Erin, did I miss anything?
Oh, no, I think you did a good job of covering it.
Okay. Also, I wanted to say that I put 2 websites in the chat. One is the WA Cares Fund, and one is the We Care for WA Cares. And that's a coalition of almost all the groups that are on the slide that Erin showed that are working to keep, it's like a grassroots organization coalition to support the commission. Right now, all WA Cares is doing is collecting the money, and the commission is fine-tuning all the rules that will go along with what WA Cares will provide. So I'm trying to think really quickly off the top of my head what we just worked on. I'll have to come back to me about that.
Okay, let me add a question for Erin, which is we do care for WA Cares, but there seems to be some proponents or some people that have created this initiative. And the question is, what the heck are they thinking? And what are their, why are they promoting a program to limit or to which they know can destroy this program? What are they saying to people?
Absolutely. Yeah, that's a great question. So some of the arguments that they'll use are that first, the benefit is too small. I believe Ruth mentioned this earlier, but the WA Cares benefits start at $36,500 in 2026. However, they grow, according to our analysis, they'll grow to $60,000 in 20 years. So the benefits grow with inflation, right? And I think, I don't remember the exact number, but for most people, they'll only need long-term care for a very short time. And this covers, let's see, 1,000 hours of professional or family home care. It covers all kinds of things that can, make your life a lot better when you're at home. I think that there's not really a lot of merit to that. Also nursing home care can be a lot more expensive, but WA Cares was never designed to cover the full costs of 24/7 care in a nursing home. It was created to provide a flexible and affordable way to access and pay for support at home, and to buy time before depleting your savings, and to offset the cost of care in a facility, right? Because in order to access Medicaid for long-term care services, you have to spend down all of your life savings to $2,000. You have to sign away your home until you're only worth $2,000, and then you can qualify for Medicaid, and that's just not right, is it? So this buys time for families.
I also wanted to add one other thing. One of the other reasons that WA Cares was developed is that the boomer generation, which some of you here are part of, are retiring and are going to start needing to have WA Care, long-term care help. The state is worried that Medicaid will bankrupt the state because there'll be so many older people needing assistance. And so WA Cares is a way for people to be able to, and also for the state to be able to put off people applying for Medicaid by about 1 year. So it's a way to help the state financially as well.
And helping the state helps us. I mean, we're talking about dollars that either we're already paying through taxes, or that we'll have to add to our taxes, or that we'll have to decrease other programs. So the cost is just phenomenal difference. And supporting people and being in their home really not just saves money for the state, but for every one of us.
Right. Right. But I just want to add one other thing. If those of you who have private long-term care insurance, there usually is like a 90-day elimination period, which means that your insurance doesn't kick in until you've already been paying privately for 90 days. So that's like if you go into a nursing home, you might have to pay $10,000 a month. So this would cover that elimination period. WA Cares doesn't have an elimination period. You do have to have a situation or you have to have a disability or need for at least 90 days. It can't be just for someone who's had a hip replacement and needs somebody for 2 weeks or 6 weeks. It has to be something that requires 90 days of rehab.
And so, Ruth, the next question is for you, which is, who's going to do it? You shared your story. Is it individuals or family members? WA Care will create funds to pay caregivers. It's difficult training and finding people. What can you tell us about providers? How can WA Care's fund actually stimulate jobs,
Right.
get people involved?
Right. Thank you. That's a good question. It's everything. Someone can employ an aide from a home care agency, which is the most expensive way to go. There will be individual providers who are paid through they're members of the union of SEIU, and they'll be available for people to hire. And then your own family can also be paid. A spouse, a child, a grandchild can also be paid to be your caregiver. And I think that it might create jobs. Yes, because what if you're caring for your mother and then your mother passes away, but you really like doing that work? You might go ahead and get more training and be a caregiver to somebody else. We don't know what's really going to happen, but there's going to be a big need for caregivers. And unfortunately, we don't have enough. in the whole country. And I'm hoping that some creative thinking is put to use with the rise in immigration. So maybe we can train newly arrived immigrants to work
And
for us.
so certainly instead of having to pay, what family members do now is they're paying out of their pocket to
Right.
not just to provide or to help support family members, but they're losing their own pay. Erin, can you comment on caregivers also?
Yes, absolutely. I'll say that just to add to what Ruth was talking about, there are over 800,000 unpaid family caregivers in Washington right now. Like that's just staggering. And this will create an opportunity for them to be compensated for their time and their labor. Also, I think just generally speaking, there's a pretty severe caregiver shortage right now already. And, silver tsunami, whatever you want to call it, it's only just beginning. So we're going to need a lot more caregivers. And in my mind, if we have infrastructure for long-term care where people can get paid, I think that's going to attract more people to the profession. Also, sort of to touch on what Ronnie was saying, all those unpaid family caregivers, many of them are people who have had to leave their career, losing their salary and their benefits. If the family is able to hire a caregiver to take their place, a professional caregiver, then that family member can return to their normal jobs, right? So that's a benefit as well.
Mhm.
So that's keeping people in the workforce. So that's creative as well. So thanks for sharing that information. Another question is about some specific things that an individual could do. The question's about if I were going to write a letter to the editor, is there a specific issue that or falsehood that the 21-24 people are using that I might focus on for a letter to the editor? Is there any highlights?
Absolutely. Yeah, we would love for anyone to write an LTE with us, a letter to the editor. We are doing workshops all the time on how to best do that and use our campaign talking points. So if you just reach out to me, I would love to put you in contact with the person who can help you write that. I guess some of the primary falsehoods, misleading statements, just generally speaking, that we want our LTEs to focus on is just telling the truth about what the care benefit can be used for and how big of an impact that can make. Also, there's a lot of misinformation that they're pushing right now that WA Cares is unfair and discriminatory to women and punishes women who stop to work and raise children, but that just doesn't really make any sense because the initiative hurts women and especially women of color the hardest because women most often leave their jobs to care for family members. Yeah, so they're saying a lot of things that don't make a lot of sense. So if you get in contact with me, I'd be happy to make sure we can support you in writing an LTE.
And you put that link in the website. Ruth, I saw you shaking your head about the unfairness to women. Did you want to throw in a comment or just
No, I mean,
agree?
I can't believe that's what they're saying. It's because women, as Erin said, women are the primary caregivers. There's many more women than men providing care, and they leave their jobs, and financially, it's very difficult for them. So either they could use the funds to hire a private caregiver and go back to their work, as Erin said, or they could become the caregiver themselves and get paid as the caregiver, or they could go back part-time. It gives them a lot more flexibility.
And a lot of healthcare issues are really women's issues as being supporters of families of one partner couldn't work without the other partner working. So there are all kinds of complications that show up. I think that's a really good question. So thanks for adding that question. There are several questions about what the benefits are. One of the first ones is, can self-employed people buy into Washington Care program? Can employers are paying like 0.5 or working people are paying 0.58%, like less than almost a 0.5% of their income, and employers are contributing a part of that. What about self-employed people, or are there other issues that we have improved since introducing the law in the first place?
I know that self-employed people can buy in. They are the one group that does have a choice to buy in or not. Anything else, Erin, about that?
Yeah, I put a link in the chat. I'll just drop it in again that explains a little bit more about why self-employed people might want to elect coverage. I'll just drop that in. And then Ronnie, I think you mentioned something about like other improvements that have been made to the program recently. I will say one of the biggest victories and something that really undercut the opposition's talking points is that the program, the benefits are now portable. So if you are vested into the program, you can take those benefits anywhere you move in the US. So that's really great. And then the second one was that, gosh, it's just
Nearly
escaping me.
retired. The nearly retired.
Thank you.
Yeah, nearly retired. So people like who are in their 50s and early 60s who work, they'll get a percentage of what they pay, what they paid in, a percentage of the 36,500. Yeah,
Even if they haven't made the full contribution or the
right.
3 years, is 3 years accurate? Am I saying
It's
the right
10
thing?
years, paying in 10 years, or 3 years of the last 6 if you are in need of, if you have to stop work and care for somebody. I mean, you have to stop work and need care right away, like if you've had a stroke or something like that, or an accident. And one thing that a lot of people get confused is the person who paid in is the caree, the person who's going to receive care. It's not the caregiver. The caregiver cannot use their WA Care benefit to care for the caree, I guess, the care receiver. That's been a lot confusing to a lot of people. And, you know, unfortunately, people in my age are not working. People who are retired are not working anymore. We won't be able to use this, but, you know, we want the next generation to have this benefit.
We've got to start somewhere.
Right.
Now, there's no better time than now.
Right.
So there's several questions about how things are beginning, or when services are payments are being made. Are there caregivers being paid through WA Cares now, or what is the next step in that process? You mentioned, Ruth, that they're developing the specifics. Is there a timeline that we can share?
Well, we started paying in 23. So the first people who will be able to get money from WA Cares will be 2026 if they've worked 3 years of the last 6. So, and that's only if they need assistance right away. So like, let's say you have God forbid, you have a car accident and you are out for a year, or out for 6 months because you have an injury, you can collect it, and then if you can go back to work and can save the rest of your award for when you need it, if you need it when you're older.
One of our questions was about creating jobs. If you can care for someone after a traumatic injury and get them back on their feet and allow them to go back to work, that's creating, putting another person to work or back to work. So thanks for sharing that. There's another question about why are we basically saying, why are we the only state that's doing this? Are other states considering it? What what do we hear from our neighbors?
Absolutely. I saw a headline recently that was something like "All eyes are on Washington," and it was about the fight against this initiative. Um, I believe that yes, 14 other states are currently, they're looking at our program, seeing if it'll work for them, seeing how to tweak it. So certainly, there's a lot of interest implementing this as well. This is a first in the nation program.
Hawaii already pays their caregivers a certain stipend. I'm not exactly sure of all the logistics of that program, but they already do something.
And someone added in a comment, just another promotion or thought for all of us to consider, which is even if you're not, qualifying for these services yourself, if you're already retired, voting no can support families and friends, but also it has an impact on each of us. This is such an expensive area for an individual, or expensive way for an individual who's dealing with a recent loss of a job, or beginning the aging process, or a loss of other family members. This is a way to support you and everyone in the community. It's like it takes a village to make things like this happen. So Washington State has become, has taken, some people have taken some very strong steps and progressive steps to provide this care, and caring steps to provide Washington Care funds. It's a perfect name for a program like this. So are there any questions that we're not seeing that I might have missed?
I
Anybody?
also wanted to say that you don't have to be a full-time worker paying in. I think I'm not sure exactly how many hours. It was 500 when it first started, but it might have risen to 1,000. But, that's only 20 hours a week of work, and then you still qualify to get it, to, pay in.
So I think I've shared most of the questions, and I see people in this group of attendants, of participants, who have shared stories about their caregiving incidents. So it's not an isolated issue. It's something that's going to affect all of us. I think the statistics were that 7 out of 10 people in our state or in our world will need supportive care, long-term care, if they want to stay in their homes, and it makes such a difference. So,
Ronnie, one other thing is people can
yes.
they can come to a commission meeting. Anybody can come and observe the commission and make comments in the public comment time.
And WA Cares Fund is the name of the organization. You can find that in your web browser and go into that. Are there any closing statements or last words, Erin or Ruth?
Go ahead.
I don't know. I guess, like I said before, we're a small campaign with comparatively small resources. So we're going to rely on organizations like this one and people like you to talk to your family and friends about this, to talk about it on social media, and to be some of our trusted messengers about this in an environment where there's a lot of misinformation. And yeah, I guess I just really appreciate your time, and thanks for having me.
And I would concur that if you're on Facebook or Instagram, there you can I think it's We Care for WA Cares, and also No on 2124. They both post, and you can post them on your page. Don't be afraid to refer people to the websites so they learn about it. I would say a lot of people don't know about the WA cares yet. They haven't realized that money is coming out of their check. So feel free to educate your children, your grandchildren, your neighbors. I think it's the younger generation that really needs to understand the benefits of this, because they don't think of themselves as getting older or needing assistance.
Or of needing to participate in a process like initiatives.
Yeah.
Most people, when they don't understand exactly what's going on or what initiative is saying, vote no. So this is important. Let your friends and neighbors and family know that this is an important issue. Democracy is a participatory sport. Tom Hartman says that every day. We need to be involved with this. We need to talk about it. And it's scary in our state to see billionaires who are the ones who can afford their own private long-term care program are trying to restrict it for the rest of the state. So thank you, Ruth. Thank you, Erin. Thanks for your work on long-term care and on Washington Cares and on multiple social justice issues. I think we are all honored by your presence tonight. You are great leaders in our community, are important leaders doing important work. So thank you, thank you, thank you. I also want to thank the volunteers who made things happen, the behind the scenes people, Ron Lovell, D.W. Clark, Rich Legoo, John Britt, and our communications team who promoted this event, Marcia Stedman, Sydney Jones, Connie Rock, and again, Ron and John, who have been here, and DW who are here, as well as Cello Echeverria. So thank you all, and for the organizations that you represent who brought you out here tonight. So thanks for that promotion. Let's keep this issue in the forefront. This is important. So thank you all for joining us, and let's get out there and tell people the truth. So thank you all very much for joining us, and have a pleasant evening. Good night.